Imagine a surface smoother than wet ice, which is the interior of your knee joint, specifically the hyaline cartilage. It is a biological marvel designed to withstand millions of cycles of impact, allowing your femur and tibia to glide over each other with zero friction. But here is the brutal reality of human biology, because that pristine surface has a fatal flaw in that it is silent and isolated. Welcome to the hidden world of knee degeneration, where you probably know the sensation all too well, starting as a dull ache or stiffness when you first wake up. It evolves into that sharp electric pinch when you tackle a flight of stairs, or that deep gnawing throb that keeps you. Awake at 2 a.m. you are told it's wear and tear or bone on bone, and inevitably the conversation turns to the dreaded S-word, surgery. But before you go down that road, we need to pause and zoom in, because today we are going to challenge the conventional narrative of knee pain. We aren't just going to throw some random stretches at you, but rather engineer a biological intervention to hack the knee's natural repair systems. The truth is that your body has the blueprint to heal, but it simply lost the supply line. So this is a comprehensive guide on how to repair your knee without the knife. If you are dealing with cartilage damage or soft tissue tears, stay tuned, because we are going to rewrite the destiny of your knees right now. Let's get into the microscopic science of why your knee hurts and won't heal on its own, which is known as the Avascular Paradox. Look at your skin, where a cut triggers bleeding, carrying platelets and growth factors to form a scab and stitch you back together. Now look at your knee cartilage, which is an avascular desert, meaning there are no blood vessels and no highways to deliver nutrients directly to damaged tissue. There are no little construction workers riding the bloodstream to patch up that pothole, which is why a knee injury feels permanent and lingers for years. The tissue is starving and sitting there damaged while screaming for repair materials that never arrive. But nature didn't leave you completely defenseless. You have a backup system called Synovial Fluid, which acts as a high-performance biological motor oil and a nutrient-rich soup holding oxygen and proteins. Here is the most critical concept you will learn today, since there is no heart pumping blood into the cartilage. The fluid gets inside through diffusion and pressure gradients. Think of your knee cartilage like a dense, dry sponge where setting it next to a puddle does nothing. But if you squeeze that sponge and release it, it sucks the water in. That is exactly how your knee feeds itself, relying on Imbibition. So every time you take a step, you squeeze the sponge, pushing waste out. Every time you lift your leg, you release the sponge, sucking fresh, nutrient-dense synovial fluid in. So when you have knee pain, you stop moving to guard it. In doing so, you inadvertently shut down the only supply line that could save you. The fluid becomes stagnant, turning from a slick oil into a thick sludge, while metabolic trash from inflammation accumulates and eats away at healthy tissue. It becomes a toxic swamp inside your joint, creating a downward spiral where pain causes inactivity and inactivity causes starvation of the tissue. We are going to break that cycle today by turning that pump back on with a protocol divided into two distinct, scientifically structured phases. Phase 1 is all about hydraulic resurrection, where we focus purely on circulation and lubrication rather than trying to build muscle yet. We are going to gently pressurize the joint capsule to flush out debris and force nutrient-rich fluid deep into the micro cracks of your cartilage. Phase 2 is structural fortification, where we fix the mechanics by strengthening stabilizers, like the quadriceps and glutes, once the chemistry is optimized. Every pound of force your muscles can absorb is a pound of force that doesn't slam into your damaged bone, building a scaffolding to take the load off. Now for a reality check, because this is not a magic pill, and physiology does not care about your schedule, so you cannot force cartilage to heal overnight. This process requires consistency and patience, meaning the circulation work needs to be your daily ritual, performed 2 or 3 times a day. It is low impact enough to do in bed, while the strengthening part is your heavy lifting done 3 to 4 times a week. So are you ready to stop managing the pain and start fixing the problem by using your body's own hydraulics to regenerate from the inside out? Let's get into phase 1 to wake up those dormant cells and target the river of life by opening the floodgates of circulation. We are focusing on the deep internal environment of the joint capsule to speed up the removal of inflammatory cytokines that tell your brain you are in pain. Here is the first movement, which is deceptively simple but biologically profound. So find a space where you can lie down, like your bed or the floor. Lie flat on your back to let gravity decompress your spine. Keeping legs hip-width apart, with knees bent and feet flat on the surface, Close your eyes to connect with your knee to identify the problem child. And let's start the engine with the decompression slide. Very slowly slide your heel away from your body to straighten the leg out, feeling the texture of the sheet and listening to that soft friction sound. As you extend that leg, visualize creating a negative pressure environment inside the joint capsule. It's just like pulling the plunger back on a syringe. You are physically drawing fluid into the center of the joint, so go as far as you can until your leg is straight, but respect the pain barrier. If you feel a sharp pinch, stop immediately, because that is your check engine light. Then back off an inch and slowly slide that heel back towards your glutes. As you bend the knee, you are compressing the sponge to squeeze out metabolic waste and flush out the chemicals that cause inflammation. We are manually operating the hydraulic system of your knee through extension and flexion. So aim for about 10 to 15 repetitions without rushing. If you go too fast, you are grinding gears. But if you go slow, you are lubricating the bearings and greasing the groove with synovial fluid. You might start to feel a gentle warmth building inside the knee, which is a good sign that life is returning to the tissue. Now we are going to layer in a second mechanism to activate the peripheral heart, which refers to your calf muscles doing the heavy lifting for your veins. When your calves are tight or weak, the old blood sits stagnant, causing swelling. So let's clear the pipes by straightening the leg and locking it in. Pretend you are driving a car by pressing your toes away from you like stomping on the gas pedal, squeezing the calf muscle until it tightens. Hold it for a second and then pull your toes back towards your nose to stretch the calf and open up the back of the knee. Do this pump about 5 times in each direction to force fresh oxygenated blood to surge through the papilloidal artery right behind your knee. Now we are going to unlock hidden stiffness, because the knee also has rotation, and when that gets locked up, your ligaments scream. Keep your legs straight and do the windshield wiper by rolling your whole leg outward, letting your toes point to the right to feel the stretch. Now roll it inward, pointing your toes to the left, which might cause a weird tightness where the tension hides on the outside of the hip. We are gently flossing the nerves and unsticking layers of fascia that have glued themselves together, so go back and forth 5 times each way. If you find a sticky spot, just hang out in that tightness and breathe into it to let the nervous system know it's safe to let go. Let's graduate to a seated position on the edge of your bed or a chair, making sure your feet are dangling to let gravity impart a traction force. We target the quadriceps tendon running over your kneecap, because if this tendon is weak, your kneecap grinds. So simply kick your foot up towards the ceiling. Straighten the knee and squeeze the quad muscle, holding it at the top for 2 seconds, before slowly lowering it back down to control the descent. That eccentric control is vital for tendon health. So repeat this 10 to 15 times to teach your kneecap how to glide smoothly in its groove. Now let's add a twist by turning your foot inward for internal rotation while lifting the leg, which targets the structures that keep your kneecap centered. Lower it down and then turn the foot outward, like a ballerina, before lifting, which targets the VMO muscle on the inside of your knee. We are hitting the knee from every vector, so do about 5 of these in each direction, customizing the movement to your own biology. By the end of this phase, your knee should feel warmer and looser as the fluid moves and the sludge clears, prepping the site for structural repair. Now that the biology is optimized, we must deal with the structural failure because loose muscles are like loose bolts on a car engine. We need stealth strengthening to build ironclad stability without grinding. So enter Phase 2, which begins with targeting the kinetic chain. Phase 2 is where we stop treating the knee like an island and start treating it as part of a machine, remembering that the knee is the slave of the hip. If your hip is weak or your glutes are lazy, your femur loses control, collapsing inward every time you take a step, which causes the knee to grind. To fix the knee, we must first stabilize the hip. Starting with the straight leg raise, which is the gold standard for early stage rehab. We begin here because it strengthens the quadriceps without compressing the knee joint, ensuring zero bending or grinding during the movement. Lie on your back with your healthy knee bent to protect your spine. Then straighten the painful leg completely and imagine pushing the back of the knee through the floor. Before you lift, you must set the anchor by bracing your core and squeezing the glute on the painful side to ensure power comes from the hip. Slowly lift the leg while keeping the knee locked straight until your thigh is parallel with the other bent knee, holding it there to wake up dormant fibers. Lower it slowly without letting your heel slam into the floor, aiming for 10 to 15 repetitions where quality matters far more than quantity. Now we pivot to target the muscles on the outside of the hip, known as the abductors, specifically the gluteus medius, which prevents your knee from caving inward. Lie on your side with the painful leg on top and lift it toward the ceiling, ensuring your toes point straight ahead rather than up to avoid using hip flexors. You should feel a deep localized burn in the side of your butt cheek, holding for 3 seconds before lowering slowly to resist gravity. This fatigue is literally the feeling of your knee getting safer, because a strong hip acts like a shock absorber to eat forces from the ground. Now let's get specific with the VMO, which is the primary stabilizer of the kneecap. Using the isometric towel press to build strength with zero grinding, place a rolled up towel under your painful knee while sitting on the floor, then simply crush the towel by driving the back of your knee down hard. Focus on the squeeze in your thigh until the muscle feels rock hard, holding that crush for 5 full seconds to recenter your kneecap tracking. We arrive at the fortress builder known as the wall sit, where you lean against a smooth wall with feet shoulder-width apart and toes pointing slightly out. Slide down into an invisible chair, starting shallow at 30 or 45 degrees, finding the sweet spot where muscles shake, but knees do not hurt. Press your lower back into the wall and hold this position, counting seconds of tension rather than reps to thicken tendon fibers and make them resilient. The final link in the chain is the eccentric calf raise, so stand facing the wall and rise up onto your toes to achieve maximum height. The magic happens on the way down, where you must lower your heels to a count of 4, as eccentric loading is the most potent stimulus for collagen synthesis. Your calves act as the brakes for your body, so you must upgrade them to save your knees, aiming for 15 reps that make them burn. That was phase 2, but we now enter the hidden dimension of knee repair called proprioception, which is your brain's internal GPS for body awareness. When you damage your knee, the microscopic sensors called mechanoceptors go offline, so we are going to recalibrate that GPS to make your knee smart again. Start with the single leg stance by standing near a wall and lifting your good leg, shifting all your body weight onto the painful knee with a tiny microbend. Every little wobble is a signal being sent up your spinal cord, forcing the nervous system to reintegrate the knee into your body map. If this feels too easy, close your eyes to sever the visual link, forcing your brain to rely 100% on the mechanoreceptors in your joint. Now we upgrade the calf raise to 3D vector, loading by rising up on your toes and shifting your weight towards the pinky toe before lowering down. Make it a circular motion by rising up center, then shifting right to lower down before scooping across the bottom to wring out the muscle like a wet towel. This exposes the knee to rotation under load in a safe environment, telling the knee it is safe to twist and turn through controlled circles. We have covered the exercises but must now discuss the 24-hour protocol, starting with the rule that motion is lotion because stagnation causes micro-tearing. You need to microdose movement by changing your position every 30 minutes, doing ankle pumps, or kicking your leg straight to keep the fluid dynamic. Rule number 2 is to respect the traffic light to distinguish between healing pain and damage pain, where green means safe tension and yellow means caution. Red light is non-negotiable sharp electric pain, which means you must stop immediately, rest, ice, and return to phase 1 without trying to push through. The timeline begins with weeks 1 and 2, focusing purely on phase 1 to get swelling down, followed by introducing phase 2 loading in weeks 3 and 4. Eventually, you will integrate complex movements like walking longer distances and stairs, but you must never stop the maintenance, even when your knee feels better. We are almost at the finish line, so let's consolidate this entire protocol into a single daily battle plan, known as your knee resurrection cheat sheet. Your morning routine begins before your feet even hit the floor by spending 5 minutes in bed doing heel slides and ankle pumps to grease the groove. This simple act sets the tone for the entire day because your joints have been stagnant for 8 hours and the fluid needs to be warmed up. The workday involves microdosing movement by not sitting for more than 45 minutes at a time, standing up to do gentle air squats or seated extensions. The evening is for structural reinforcement, where you perform wall sits and isometric towel presses 3 to 4 times a week to build armor. Finally, before you sleep, do the single leg stance while you brush your teeth to recalibrate the GPS and integrate the knee into your body map. Now I need to address the ghost in the room, which is the invisible barrier called kinesiophobia, or the fear of movement that stops people from healing. When you have been in pain for years, your brain rewires itself to protect you, creating a pain memory even after the tissue is healed. It is a false alarm, like a smoke detector going off when you make toast, so you have to retrain your alarm system to prove movement is safe. Every time you do a wall sit and don't get hurt, you are overriding the code, telling your nervous system that we are safe and breaking the cycle of decay. This journey is not linear, as there will be days when the storm returns, but you now understand the mechanism of avascular cartilage and synovial fluid. You are no longer a passive victim of bad knees, but the active architect of your own recovery. So give this protocol 30 days of consistent effort. You will reclaim the mobility you thought was lost forever, and realize that the diagnosis on your MRI is not your destiny. Healing is possible if you keep moving and stay consistent. So remember that motion is lotion, and never let the swamp settle in your joints.